I believe I've got several topics here, and we'll just go till you guys get sick of it.
Okay,
Cool.
sounds good.
And the first one may be fake. It was sent to me by Scott, and I just I'm wondering if we're getting what do you call it when you get
Spammed.
doped?
Gaslit,
Gaslighted.
gaslighted. Yes.
So it's from Unilad. A family that only walk on all fours leaves scientists baffled as they shouldn't exist.
Well, no, they're just goofy.
Evolutionary psychologist Professor Nicholas Humphrey headed up the team who looked into the family. And the team were left shocked when they discovered that of 18 children born into the Ulos family, 6 of them had a unique disability, which resulted in them walking on all fours. Turkish scientists thought the family had devolved
No, come on.
and found that conclusion was deeply insulting and scientifically irresponsible. Instead, he set about trying to find some other answer in the reversal of the evolution process localized within one family in Turkey. Neurological scans showed that the middle of the cerebellum appeared to be shrunk, but that provided no conclusive answers as people with smaller or even no cerebellums still can walk upright.
Of course.
Scientists appeared stumped as to what exactly was the cause for all this, as they could make observations, but the answer to the question of why this was happening eluded them.
Is this the Ulas family?
Yes.
Yes, it is.
Okay. Yeah. All right. I know a little bit about this. Go ahead.
When he returned to visit the family again, he found that their children could now walk upright after being given help from a physiotherapist and equipment. So this became viral, and it wasn't until years later that a team of Danish scientists finally found the answer as to why the families were walking on all fours.
Okay.
And
they
called
published
it
a paper, right? Cerebellar hypoplasia, was it?
cerebellar ataxia, mental retardation, and disequilibrium syndrome.
Disequilibrium.
Right.
CAM-RQ, very rare syndrome that derives from an incredible rare mutation which prevents proteins from distributing molecules of fat properly.
Wow. Yeah.
That results in defective nerve cells, brain damage, and loss of balance.
I just thought that, the parents were weird and decided that they were going to walk on all fours, and then the kids just picked up from the parents because they're going to do whatever the parents do. But it turns out that Tacey is 100% correct. They have cerebellar hypoplasia. So the cerebellum is the part of the brain that has the internal map. That's one thing. So when I close my eyes and I point at Dr. Scott, the cerebellum is where the map is. Remember when I had my hypnopompic episode, and I could see all the details in the bedroom that I was in, but the lights were completely out and it was pitch black in there. But in my mind's eye, I could see it. That's all in the cerebellum. The other things that the cerebellum allows you to do is to walk in a straight line. So people with cerebellar ataxia lose the ability to walk in a straight line. They start out walking like drunks, and then eventually lose the ability to walk altogether. So these people had cerebellar hypoplasia, meaning that their cerebellum was malformed genetically, and it was very small. And it says it's a form of non-progressive congenital cerebellar ataxia. So when they say non-progressive, it means you're born with it, and it doesn't get any worse, but it's not going to get any better either. Okay. And they will have mild intellectual disabilities. It says this condition affects the balance of 12 of the family's 19 children who walk on all fours as a result. Wow. Oh, and they also have a reduced corpus callosum, which is the connection between the right side of the brain and the left side of the brain.
Wow.
Isn't that interesting?
That is. So, yeah, I just assumed when she was going to read it, they had some kind of
hip thing.
Weird, hip or lower back kind of fusion kind of thing, kind of weird vertebra or something.
Because we're not really made to walk on all fours. Our hips are rotated so that we're designed to walk upright. So it is very uncomfortable to walk on all fours, and our ass will stick straight up. Whereas if you have a hip that's rotated slightly forward, then you can walk on all fours like a chimp or something, but they can they can walk straight up, but it's uncomfortable for them. Mm-hmm. So it's just the opposite. That's pretty interesting.
Wow, that is good. That's good taste. You kind of wonder if the physiotherapist put them on like balance kind of training and balance exercises and things of that nature. And certainly had to do some strengthening stuff in the spine to stand them up.
If the wiring isn't there, they may not be able to do anything, but it's amazing that they were able to get some of them to walk standing up. So that's pretty cool. Yeah.
Good topic, Taste.
All right. What else you got?
Well, thank you, Scott. I've got some weird and mysterious diseases of the human body. The first one is persistent sexual arousal syndrome.
Oh, wait a minute.
Called PSAS, also called the persistent genital arousal syndrome.
Yeah.
PGAD. Causes people to live perpetually at the brink of an orgasm.
Hope that Hussein.
What was that?
Sorry, that was the YouTube still going, yeah.
The sensations are partially relieved through orgasm, but may return suddenly within a few hours. It can lead to constant physical pain, stress, and psychological difficulties due to an inability to carry out everyday tasks.
No shit.
So you may suffer from anxiety, depression, distress, frustration, guilt, insomnia, panic attacks.
So what's the treatment for it? Do they give a treatment?
Cognitive behavioral therapy.
That's it?
Mm-hmm.
Wow.
I wonder if how about putting them on Prozac?
Like a big SSRI.
Yeah, SSRIs kill your libido anyway. Yeah. I wonder if that would work. What's the name of this syndrome, Tace?
PSAS or PGAD.
Persistent sexual arousal.
Sexual arousal.
Now, do we need to start him on a 3-minute?
Yes.
No.
No.
No, these aren't questions. This is Tacey's time of topics.
This is important.
So maybe it's Tacey's decision.
Okay, listen to this. According to PubMed, some SSRIs may worsen persistent genital arousal disorder. During treatment or withdrawal. Wow. Knowledge on pharmacologic treatment options for PGAD is not yet evidence-based. Yikes. Wow. Well, that is an interesting turn of events.
That's kind of crazy, isn't it?
Yeah. Most importantly, some drugs such as serotonin reuptake inhibitors, SSRIs, like Prozac, Paxil, Zoloft, may even induce or worsen PGAD during treatment or withdrawal. Okay, we now need an initial spark in order to promote basic research on the origins of PGAD. Yeah, no kidding. If you don't know what's causing it, it's very difficult to treat it. And it says clinicians should provide careful diagnostics and counseling for affected patients. Wow. Drugs that are able to inhibit sexual excitation, such as pregabalin or duloxetine. Duloxetine is a serotonin norepinephrine reuptake inhibitor, also known as Cymbalta. It says may be worth a trial. So very interesting. Pregabalin is also known as Lyrica, which we use that for neuropathic pain. Goodness gracious.
It's crazy, isn't it?
Yeah, you would think that we would have something for that. But anyway.
Maybe it's just not that common.
Yeah, well, that's part of the problem, isn't it? When you've got an orphan rare disease, it's hard for pharmaceutical companies to justify the amount of money it takes. However, I have a friend who's been on the show that has Graves' disease, and he took that Tepezza stuff. It's $800,000. It's an orphan drug. For Graves' ophthalmopathy, so that people with Graves' disease, their eyes will poke out because the tissue behind the eye will enlarge, and so they have a drug for this. It's $800,000 a dose.
Goodness gracious!
And you have to do it 4 times. So $3.2 million. His insurance paid for it.
Oh my gosh! How do they take it? Is it?
It's an IV infusion.
Yeah. Okay, gotcha.
And it didn't work that great.
Oh, goodness sakes!
Yep.
Wow.
So that's one way the firm. Sorry, shit. Hang on. I was doing pretty good. Hang on. Sorry. see. Yeah, he has that Graves ophthalmopathy, and he took this drug Tepezza, which is decreases the swelling behind the eyes,
So their eyes don't stick out so far.
their eyes don't. So that's what happens in Graves' disease. Right. Their eyes kind of poke out,
Right.
And so he had double vision and things like that because your eyes aren't supposed to poke out like that.
No, and they got to get dry too, don't they?
Yeah.
I would think so.
So there's all kinds of problems with it, and it's an orphan drug. It's $800,000 per dose, and he had to take it 4 times. So it's $3.2 million.
Holy smokes!
And on top of that, it didn't really even work that great. But thankfully for his insurance paid for it. But that is one strategy that a pharmaceutical company can adopt if they've got an orphan drug that only 10 people are going to, or 100 people are going to take this year. Just charge $3 million for it.
Exactly.
That's that old saw. You price something at $1 million, you only have to sell one of them. But
Exactly.
Anyway. All right.
That's crazy, dog.
Yeah. So that's one of the problems is this is extremely rare and nobody is really doing a lot of research on it. So what this will be is someone will try something and have a great result and they'll publish it as a case study. Okay. Then other people will try it. If it really works, then it'll become common.
Gotcha.
But sometimes, but it's all off the shelf drugs. That's how this will be solved, if it can be solved.